I'm Lucas, and I'll be presenting on ADHD. I'll be going over how it's diagnosed, the types of ADHD, causes and treatment of ADHD, and how I believe it's relevant. So, what is ADHD? Attention deficit. It's ADHD stands for Attention Deficit Hyperactivity Disorder, and it's a neurological disorder which causes inattention, impulsivity, and hyperactivity. You might know it as ADD or Attention Deficit Disorder, but this term is outdated as it only describes one type of ADHD. One of the most common mental disorders. According to psychiatry.org, it's one of the most common mental disorders. A lot of you either probably know people with ADHD or have friends with ADHD. How's it diagnosed? Well, a diagnosis is based off of recurrence of symptoms over a period of time in more than one setting. For example, symptoms can't only be seen at home, or they can only be seen at school. To receive a diagnosis, a person has to be showing symptoms, at least 6 symptoms, or 5 if they're 17 or older. There are 3 types, and the diagnosis of the type is based on what symptoms the person has. The 3 types are primarily inattentive, primarily hyperactive, and combined presentation. Combined presentation is a little more complicated to diagnose, but I will get into that in a second. So what's the first type? The first type is primarily inattentive, which is basically what it sounds like. Someone with primarily attentive ADHD has problems focusing, staying organized, that kind of thing. Symptoms of this type include avoidance or dislikes of tasks that take sustained mental effort, being easily distracted, poor time management, anything like that. The second type is primarily hyperactive, which is again what it sounds like. People who have this stuff are mainly dealing with problems with hyperactivity, or basically constant movement. Symptoms of this type include having a tough time sitting still in their seats, excessive movement, fidgeting, cutting into conversations they're not part of, or having a difficulty waiting their turn to speak. And then the third type is combined presentation, which is basically just the person has symptoms of the previous 2 types. Diagnosis of this type is a lot more thorough. It involves a psychiatric evaluation, complete family and medical history, questionnaires, and extensive questions about a person's background, their education, the environment they grew up in. And the reason it's so extensive is because other mental disorders can easily be mistaken for ADHD, such as learning disorders, substance use, and some other. What is the cause of ADHD? Well, the exact cause is not known, but evidence suggests it's genetic, as well as we can see some biological differences between children who have it and children who don't, such as children who do have it have more gray and white brain matter than those who don't. Other factors that have been linked to this disorder are stress during pregnancy, exposure to substances, and low birth weight. So how is this disorder treated? Well, it's considered chronic, so it can't be cured, but it's treatable through therapy and medication. According to the Child Mind Institute, the most common kind of medication is stimulants, which increase dopamine levels in the brain. Methylphenidate and amphetamines are what is used to make medications that are stimulants. Adderall, Ritalin, and Focalin are short-acting medications that typically last about 3 to 4 hours. And then there are more long-lasting medications like Concerta and Adderall XR, which last about 8 to 12 hours and are good for children who are trying to get through a day of school, for example. But not everyone reacts well to stimulant medication. So there are some non-stimulant medications, such as clonidine and guanfacine. And what these do is they are meant to lower high blood pressure. These medications are extremely short-acting, and people taking them typically require several doses a day. So how many people have this disorder? According to CHAD, children and adults with attention deficit hyperactivity disorder, In 2022, 3.5% of the population has ADHD. 3.5 sounds like a very small number, but what that comes out to is about 11.5 million people who are living with ADHD in the US. So, in conclusion, ADHD is a complicated neurological disorder people often misunderstand or have an incomplete picture of. It can be difficult to diagnose because of the way it can mimic or be mistaken for other disorders, as well as the fact that there are different kinds, which just means you have to be careful. So why is it relevant to you? Why should you care? Well, because it's a fairly common disorder, you probably know people with it, but because it's often misunderstood, having a proper understanding of it is important to understanding those people and having good relationships with them.